how are you doing today? I am Susie Student from the University of South Alabama, and I'm going to be conducting your neurological assessment today. Is that okay?
Yeah, that's fine.
Okay, so I'm going to start with, now they can stand for this or sit for this part, okay? Typically I have you stand, but I'm going to start with you sitting, okay? Alright, so your appearance today, you look, your posture is good and erect. Your appearance is good, your dress is appropriate, your grooming, your hygiene look good today. Your behavior, you are awake and alert. You are, how are you doing today and what is your name?
I'm doing good. My name is Jared Baker.
Okay, your speech is clear. Have you been having any anxiety or depression or suicidal thoughts?
Nope, only nursing class.
Only nursing classes cause you a little stress? Okay, if you were having any of those, or I could assess you a little further, we can go deeper with some more different types of testing. Okay, now we're going to move on to your cognitive level. Can you tell me your name again?
Jared Baker.
Okay, can you tell me where we are?
We're at South Alabama in the Allied Health Building.
Okay, and can you tell me like the day, time of day?
It's morning.
Morning,
And
okay.
May 15th.
Okay, May 15th.
Or March.
March
My
15th.
bad. I messed up earlier.
All right. Okay, and I'm going to test your recent memory. What did you have for breakfast today?
I had a bagel.
Okay, and I know that because I brought the bagel into him and saw him eat it. Okay, now I'm going to test your remote memory. Can you tell me who was the president before Donald Trump?
Barack Obama.
Okay, and now we're going to move on to your thought processes. So can you tell me, I'm going to test your abstract thinking, can you tell me what it means to find a needle in a haystack?
It's hard to find.
Okay, and now I'm going to talk about your judgment. If you were driving down the road and you saw a police car with flashing lights behind you, what would you do?
Pull over.
Okay, or I could say, in 2 years, what do you expect to be doing with your life? Where do you expect to be?
Active duty, military.
Okay, all right. So now I'm going to move on to your cranial nerves, okay? So the first cranial nerve we're going to assess is cranial nerve 1, the olfactory nerve. So I need you to occlude one nostril, sniff for me please. Okay, the other nostril. Okay, all right. Now I need you to close your eyes for me. I need you to occlude one nostril and smell the scent.
Pineapple.
Okay, now I want you to open your eyes for me, occlude the other nostril, and sniff.
Peppermint.
Okay, so he identified the sense correctly, so cranial nerve 1, the olfactory nerve is intact. The second cranial nerve that we're going to test is the optic cranial nerve, and so the optic nerve, so I need you to, what we would use typically is a Snellen eye chart. If I had a Snellen eye chart, I would have him stand 20 feet away from that, cover one eye, and read. If I got a reading of 20/50, it would mean at 20 feet, he could see what the normal eye could see at 50 feet. But since I do not have that, and I have the handheld vision screener, I will flip it 14 inches from his face. I'm going to have you cover one eye and read the lowest line that you can read. Just say A, B, C, D.
Okay, A, B, C, D.
Okay, all right, can you cover the other eye for me, please, and read it?
Alright, A, B, C, D.
Okay, so I'm going to look at those readings. Okay, he has 20/20 vision. Okay, so now I'm going to move on to cranial nerve 3, the oculomotor. And what I'm going to do is I'm going to look at your pupils. Okay, his pupil size is 5. His pupils are equal. And now I'm going to shine a light in your eyes. Okay. His right pupil constricted. And now I'm going to do it again. I'm going to see if the left pupil will constrict as well. Okay, and it did, so he has consensual pupillary constriction. All right, now I'm going to do accommodation. So I need you to look away at that exit sign up there. Okay, and his pupils have dilated. Now I need you to look at this pen light for me, please. And his pupils have constricted, so that is accommodation. Now I need you to look at this pen light, and I want you to follow it. Yeah, okay. So his eyes. His eyes turned inward, so they converged on their axis. So his pupils were equal, round, reacted to light, accommodated, and converged. Okay. Now I'm going to go ahead and do cranial nerve 3, which is oculomotor. I'm going to do cranial nerve 4, which is trochlear, and cranial nerve 6, which is abducens. And I'm going to test those using the EOM extraocular movement exam. So what I need you to do is hold your head really still, and I need you just to follow my pen light with your eyes only, please. Don't turn your head. I noted parallel tracking and no nystagmus during that exam. So now I'm gonna go back and I'm gonna do the trigeminal nerve, which is cranial nerve number 5. So what I need you to do is to clench your jaw for me. I'm gonna palpate, and I'm gonna try to pull down on your chin. I want you to resist me, okay? All right, okay, good. So the motor portion of trigeminal nerve is in number 5, cranial nerve number 5 is intact, and now I'm gonna do the sensory portion. So I need you to close your eyes for me, please, and when you feel me touch your face, I want you to say now, okay?
No.
Okay. So cranial nerve 5, the motor and sensory portion, the trigeminal nerve are intact, okay? Now I'm gonna move on to cranial nerve number 7, which is the facial nerve. I need you to follow and mimic me when I make some faces, okay? I need you to smile. I need you to lift your eyebrows. I need you to puff out your cheeks. Okay, so air came out evenly. So the motor portion of cranial nerve number 7, the facial nerve is intact. If I was going to test the sensory portion of this, I would get something salty or sweet and place it on the anterior 2/3 of the tongue and have him identify it, but I'm not going to do that. So now I'm going to move on to cranial nerve number 8, which is the acoustic nerve. So I need you to cover one ear for me. I'm going to whisper a word to you, and I need you to repeat the word back to me, okay?
Yeah.
Okay, will you cover the other ear for me, please?
South Alabama.
Okay, so I did not detect any high-frequency hearing loss, so cranial nerve number 8, the acoustic nerve, is intact. So now I'm going to move on to cranial nerve 9, which is the glossopharyngeal, and the cranial nerve 10, which is the vagus nerve, and I'm going to test those together. So I need you to open your mouth and say ah. Okay, so the uvula grows on phonation, and I also, to test this, I could take a tongue blade, stick it back, and elicit the gag reflex, but I am not going to do that today. And to test the sensory portion, I could place something salty or sweet on the posterior 1/3 of the tongue and have him identify it. So cranial nerve 9, the glossopharyngeal, and cranial nerve 10, the vagus nerve, are intact. So now I'm going to move on to cranial nerve 11, which is the spinal accessory nerve. So I need you to, we're going to go against resistance, so I need you to push your head and against the resistance, okay? Resist, okay? Now I'm going to push down your shoulders, and I need you to resist and lift up, okay? Cranial nerve 11, the spinal accessory nerve, are intact. We've not noted any deficits. Now I'm going to do cranial nerve number 12, which is the little hypoglossal. Okay, so I need you to stick your tongue straight out for me. Okay, looking at your tongue, there's no deviation to the left or the right. I need you to repeat after me: light,
Light.
tight,
Tight.
dynamite.
Dynamite.
Okay, cranial nerve 12, the hypoglossal nerve is intact. Okay, so now I'm going to move on, and we're going to test your cerebellar function. So I'm going to get you to take your shoes off if you don't mind. Okay, I'm going to have you walk to the table. Okay, I'm going to have you turn around, and I want you to do a tandem walk back, which is heel toe back to me. Okay, all right, going over the gait was smooth as he was walking across, and he was able to do the heel toe without losing his balance. Okay, now I'm going to perform the Romberg exam. So what I want you to do is I want you to stand here, I want you to close your eyes. I'm going to support you, and I'm going to assess you for 20 seconds to see if you have any swaying, abdominal swaying. Okay, I would do this for 20 seconds in the field. However, I've watched him. He didn't have any minimal swaying or no swaying, so I would say he's a negative Romberg. Okay, so now I'm going to have you come back over and sit down for just a minute. Okay, now I'm going to do the sensory portion. I want to see your hand. This is sharp. This is dull. I want you to close your eyes, and I want you to tell me when you feel sharp or dull, okay? Are you ready? Okay.
Dull?
No.
I don't know. Short.
Okay.
Maybe that's dull.
Okay.
I can't really tell that one.
Oh, gosh.
Short. Dull.
Okay. All right. All right. Now I'm going to move on to your reflexes. I'm going to check your reflexes. So we're gonna start with the bicep tendon. I need you to relax as much as you possibly can. Okay, so able to elicit that, okay? Now I'm gonna do your tricep tendon. No, don't go back. I want you just to relax. No, just relax. Okay, relax. Okay, all right. Now I'm gonna do your brachioradialis. I just need you to let your hands hang. Please let me support them. Okay, I was able to elicit that. Now I'm gonna do your patellar. So I need you to take your arms and pull apart. Okay, I was able to elicit that one. Okay, now I'm gonna get you to relax now. I'm gonna do your Achilles tendon. So I'm gonna hold your foot up like this. Just relax. I want you to relax your leg. Don't. Okay. All right. I was able to elicit your Achilles. Now I'm gonna do your Babinski. Okay. This may tickle a little bit. Okay. All right. You ready? Okay. He curled his toes. So I would grade his reflexes a 2. His normal reflexive behavior, and so I'm just going to do it on one side, but I would do this bilaterally, okay? And so, okay, so during this exam, I was looking at him, listening to his verbal response, and also his motor response, and Glasgow Coma Scale. Okay, I was like, I just went blank. So his verbal, motor, and that's my problem. Thank you. So he opened his eyes, so I grade that 1 to 4, so I would give him a 4. He was able to answer me clearly for speech, so he gets a 6 for motor, and I would give him a 5 for his verbal response. So he would get a score of 15. If he had a score of 3 is the minimal score you can give on the Glasgow Coma Scale, 15 is the highest score you can give on the Glasgow Coma Scale. If he had a 7 or less, I would know he was in a coma, but I would give him a 15, and that completes my exam. All right, any questions?